So hello again. Today we're looking at Enerpeel salicylic acid chest and back. This product is a new innovation for treating back and chest acne, and today we're going to demonstrate how to do the treatment on this young gentleman's back. You can see he has a few minor spots, but this is designed to clear them up. It is a spray peel, and therefore both the client and the practitioner should wear a mask. You shouldn't be inhaling the salicylic acid. Again, the salicylic acid is in an Enerpeel carrier, and the Enerpeel carriers will transport the salicylic into the skin, into the stratum corneum, and have an exfoliating effect to unblock any pilosebaceous ducts. It will also take in the ingredients found in Acne Care chest and back, and also Tebiskin OSK chest and back. Both of those have ingredients which will target the bacteria that's causing the inflammation, and also it has anti-inflammatory properties. These are also in the Enerpeel carrier as well, so when you do the Enerpeel chest and back peel, you're also sending in a large dose of the active ingredients in the creams. So first thing we do is we'll take the Enerpeel preparatory wipe, which are based on alcohol but also a propanone, and these will remove any surface lipids and cleanse the area and reduce skin bacteria before we apply it. So open up the wipe as we demonstrated here. Just go over the area. They are quite sharp, so always wear gloves with them, and sometimes you might even let the client have a sniff of them just so they can get used to them. So clean the area. Once that's done, then we can take the Enerpeel SA spray, and there's 5 mils of spray in there, and literally apply it across the area, and one of the sprays will do the whole of a back. Get a good covering as we're showing here. Now the salicylic acid is 30%, and it will have a bit of a tingle. And make sure we get the whole area covered. If you've got any specific spots, then maybe put a bit more in those areas. Keep going until you've got it all onto the skin. And then take the little roller. Now this is like a knobbly roller, and that helps to spread it over the area, so you get coverage of the whole area. I'm wearing a mask, but even I can smell the salicylic acid, so it is important that you do wear a mask, otherwise you may find yourself coughing and spluttering. So over the area. Now the salicylic acid will do its work, and then it actually neutralizes itself. It converts into a salicylate, which is an aspirin-like product, and actually that has an analgesic effect. If somebody's aspirin allergic, you wouldn't use it, and if somebody's aspirin allergic, they probably shouldn't be in the room while it's being done. So we just leave that now for a few minutes. Any tingling, Tim?
Only a slight little bit.
Okay, that's what's to be expected. So this will carry on penetrating into the skin, taking in the key active ingredients of the triethyl citrate, the ethyl linoleate, and the GT peptide 10. GT peptide 10 opens channels up into the bacterial biofilm, allowing the triethyl citrate to release citric acid, which is released using the bacteria's own lipase enzyme. The citric acid will drop the pH and make it very acidic inside the bacterial biofilm, and that will kill 96% of P. acnes in the biofilm. The ethyl linoleate also breaks down to release linoleic acid, and that helps to reduce the sensitization to DHT and restore some fatty acid levels in the skin. So now we would take the remover wipe. As I said, we don't need to neutralize, we just need to now wipe off whatever's remaining on the area. And you can go over it in the sort of the same order as you applied it, just to take it off. Now, there is some white powder there, but it's not not massively obvious, but that's what would happen. So we're just reaching the 5 minutes now. Just gently blot and gently wipe. These are removers, so they just cleanse the surface. They have hydrating ingredients in and also silicone in, so they help to calm and soothe as well as that. Once everything has been removed, then just leave it a few seconds just to allow everything to calm down if necessary. And then, as with any Enerpeel, you can actually then wipe over the skin with a damp cloth, gauze or cotton pad with just some clean water. We're using saline, just to remove any of the remaining elements of the peel or the remover, and just so the client can, when they don't have any stickiness remaining afterwards. Very simple procedure to do. You normally do 3 or 4 of these 2 weeks apart, and in between that they would also be using the back spray treatments twice a day. And once you've gone over that, it's actually a good idea now to actually apply a dose of the, in this case, Tebby Skin OSK Chest and Back. These both come in a spray form, so they can be self-applied and there's very little rubbing in needed, which self-application on the back makes it a lot easier. So just spray over the area and then using the gloved hand just spread it over. Make sure it's well rubbed in. And there you have it. That's an Enerpeel Chest and Back. Thank you for your attention.